What's up, guys? So today we are going to talk about a procedure to make somebody have a more chiseled jaw, or at least that is how it is advertised. There are certainly celebrities that have had this done, and it is sometimes talked about, or maybe not talked about, but done by those in the fitness industry. So anything in the fitness industry, anything that is related to aesthetics, I would say is at least tangentially related to the fitness industry, because that's what a lot of people are going for, is the aesthetics of it. However, once you start branching into the realm of plastic surgery and certain procedures, you have to consider the risks there. Certainly, we see fads like people talking about mewing and other things like that to grow a more muscular or masculine jaw. And it's not that there's no validity to things like that. However, I think, again, before you're doing anything, we should look for actual evidence. So in this video, we're going to talk about the buccal fat pad removal. And the buccal fat pad is basically a fat pad in the cheek here between the buccinator muscle and the masseter muscle. There are other muscles and of course structures in that area, but that's primarily where it's located. And what is done is after anesthetic is given to the patient, an incision is made inside the mouth, so it is done intraorally. It can often be done without being put under or anything like that at a hospital. You can often do it in an office. And you'll basically, you separate the structures. You'll look for a yellow fat pad in there. It's usually pretty identifiable, and then it is taken out. However, there are reports of other structures being taken out during the procedure. There are definitely reports of nerve damage. So you have the facial nerve in that area. There's the parotid duct that you can do damage to. There's other blood vessels in the area. So it is absolutely something that you have to be careful of for people performing this surgery. As I discussed in that video on Zac Efron and just plastic surgery in general and male standards, I'm not necessarily for or against any given procedure. However, I do think that once you are going to the extreme of getting surgeries done, you maybe have to consider why you're really doing this, if it's necessary, and if there are healthier or less risky alternatives. So we just discussed some of the risks there, but the other side of it is it won't necessarily give you the results that you're probably hoping for. So if you were just to Google before and after pictures, a lot of times other things, as is the case with many before and after pictures for procedures and fat loss and diets and things like that, there's other things going on. So sometimes it is combined with liposuction. Sometimes you'll see somebody who it's a completely different face. They had a rhinoplasty, they had buccal fat pad removal, they had liposuction, they have makeup on, they're smiling. There are other things going on there. So even though there can be significant differences seen by removing the buccal fat pad, it is not going to get rid if you have a double chin. It's not going to get rid of if you have fat cheeks, puffy cheeks up here. It's not going to get rid of that. So people will maybe get this procedure thinking it's going to make them look like a movie star, and that is not necessarily the case. Another major concern is that as we get older, we lose fullness to our face. So I was actually at a CE course for the American Academy of Facial Aesthetics, and I will say there was a younger woman there who was telling me that the reason that we look older is because we lose fullness in our face. That is true. I've seen it taken the other way to the extreme though, because this individual had a lot of filler, and it was definitely an unfortunate situation where sometimes you see somebody who it really needs somebody close to them to tell them they've taken something too far. So you do have both extremes, but the reality is that as we get older, we do lose fullness. And the problem is if you're then removing the fat, you can almost look more aged. And especially as somebody's getting into their 40s and 50s and you have these sunken cheeks, you can't then just go and put more filler in that area. First of all, filler will dissolve over time. It will drift. You kind of get that almost like worked up look to you. Really, once that buccal fat pad is gone, it's gone. I mean, you could do fat transfer and things like that, but ultimately it's not the same. You do run that risk. For the most part, I can't really think of too many situations unless somebody really is predisposed to having a lot of fat in their face that is disproportionate to the rest of their body. For most people, I would say it is not a great idea, and there are other alternatives, the main one of which would just be proper fat loss. So it is certainly true that people hold fat differently. And we can all think of somebody, I have a friend who could be 25% body fat and has a jaw chiseled by the gods. And I have another friend who, even when he's relatively lean, he's just got softer features. And that's just variability in genetics. But most people are going to get a more chiseled jaw if you just lose fat. Most men, for example, if you're 10 to 15% body fat, are going to have a reasonable looking face. And then most people, as they get really lean, I mean, then it gets to the point you see these contest bodybuilders where it's almost too much and you don't necessarily want that look, especially if you're not that lean, which again could happen. As far as actually building out and having a more muscular jaw, I would say that for the most part, that's pretty tough. I mean, as one is lifting and just gaining muscle in general, you tend to build muscle globally. And some people who actually clench, which is not a great thing dentally, but as people are clenching, they will sometimes build up the masseter muscles here. So we have patients who we will actually give Botox to, and we will give Botox to prevent them from clenching as much. And you will see a slimming of the face. But that's not that their face is getting leaner, they're actually losing muscle. So more so, that's something maybe desired by some women who really clench, that they will have a slimmer face. But I've seen some guys too, where, I mean, it's a dramatic before and after. So I would just say that yes, of course, using the muscles and even orthodontic changes can kind of change the structure of your face. But for most people, as far as things to do at home, mewing and things like that, I don't know if it's really worth most people's time to delve into that area. I think we have examples like Zac Efron, where I'm not even 100% sure what was done before and after for him, but if you've seen the photos, it looks like some combination of filler. It could potentially be some implant surgery there, but it looks like filler for the most part, where you have something that's so great and then you mess with it, and in his case, he was unfortunately very much ridiculed. But I would say when it comes to facial aesthetics, the biggest thing for most people is just going to be getting lean enough, right? This is not to say that you should be walking around shredded all year round. However, most people, if you're not above 20% body fat, your face is probably going to be reasonably lean. And I certainly wouldn't mess with something like this. There's something else called Kybella that is injected into it. It's shown for mental fat in this area, but it requires a lot of injections. What they're actually injecting could potentially be harmful long-term. Again, it's not something that I would recommend. You don't want to do anything that you can't undo, and a lot of times that is the case with these surgeries. Just a quick video, which is kind of in my area of expertise, so I just wanted to discuss it because, like I said, it is kind of relevant to the fitness industry when it comes to aesthetics at the expense of health. Let me know if you guys have any interest in more videos like this, discussing anything like Botox, fillers, veneers, surgeries, any facial surgeries, things like that. It is something that I can comment on. So subscribe to the channel for more like this, post down below, and I will see you guys next time.